Welcome back. As of today, a cumulative total of 650,749 confirmed COVID-19 cases in South Africa have been recorded, with 956 new cases identified. The total number of COVID-19 related deaths has risen to 15,499. The deaths are from KwaZulu-Natal, Gauteng, Eastern Cape, Western Cape, Northwest and Free State provinces. The health minister says less than 1,000 new coronavirus cases were recorded in the country on Monday. This as President Cyril Ramaphosa will any day now announce a move to alert level 1 under national lockdown. Dr. Francesca Conradi is the Deputy Director, Clinical HIV Research Unit at Wits Health Consortium. She joins us now. A very good evening to you, Dr. Conradi, and thank you so much for speaking to us. Now, are we ready for a move to a more moderate public health safety regulatory system?
Yes, I believe the time is right for us to move. So many South Africans have got used to the idea of what we call non-pharmaceutical interventions. We wear our masks in public, we don't stand close next to each other, social distancing. And they have been shown to work quite well. And we are approaching some degree of herd immunity. So I think it's time that we moved to level 1. But it's not the time for complacency. This is not over yet. And I know people say that that's what we've been saying all the time, but we have to continue to be careful.
I want to talk about that herd immunity within the context of the vaccine trials that are underway, but I also want to talk about the antibody test. Who should get one, and what is the difference between an antibody test and the PCR test?
Okay, so let's start off with what does herd immunity mean. It means that there are enough people in the community that the virus can't spread like wildfire anymore. And there are different levels for different viruses. And we all know that SARS-CoV-2 is relatively new, but we think herd immunity is around 50%. A study recently conducted in Cape Town amongst women particularly and HIV-infected individuals who attend public health clinics showed a herd immunity of between an antibody response between 39 and 43%. So what does that mean? We've excluded people from those studies, people who were not attending clinics because they were either in the private sector or under the age of 18 or above 65. But it looks like we're getting there, particularly in the high populated areas like Khayelitsha, Klipfontein, and certain areas in Gauteng. Antibody tests, they are not an immunity passport. We know that people who are infected with this virus develop an antibody response to varying degrees, often related to how many symptoms they had. So the sicker they were, the higher the antibody response is. We don't know what it means in the long term. We think probably it means you won't get it again. Should I rush off and have an antibody test now because maybe I've had it? The answer is clearly no. Antibody tests are really reserved for epidemiological tools. So we can look back and see where the hotspots were. They're not meant for diagnosis.
I want to ask about the genome sequencing laboratories that have been set up. And as we're talking about the antibody test, it all depends on when you test. So it's your blood and in relation to your recovery or the non-neutralizing antibodies. Talk to us through that.
Okay, so when we get exposed to infection, it takes our body time to develop this protein response or antibody response. Remember when we talked about HIV all those years ago, we referred to the window period. And that was the period between when a person was exposed to HIV and when they actually had an antibody response. So there are two types of antibodies that we can develop broadly. One is a neutralizing antibody, which the antibody attaches itself to the outside of the virus. Cells don't kill the virus off. And then there are non-neutralizing antibodies, which just merely tell us that our bodies have seen the virus before, and it's kind of almost like a negative picture. They know that they're there.
I'm sorry to rush you, Dr. Conradi, but I do need to ask this final question. Do we have enough spatial data to understand what the relaxed level will bring with it, especially if we're going to ensure that we reduce the risk of a much higher risk of infection? Super spreading.
I think the answer to that one is yes. I think we've got enough geospatial data, certainly within the higher metropolitan areas, where the transmission is going to occur. Let's face it, not many people live in the middle of the Karoo. So I think we do. We have a heightened awareness, and this is not the time for complacency. President Ramaphosa, we're looking forward to your address, and we will obey the rules. Thanks very much.
All right, thank you so much, Dr. Francesca Conradi, Deputy Director, Clinical HIV Research Unit at Wits Health Consortium. Thank you so much for speaking to us. Francis?
Thank you very much, Sipi. So let's go back to our earlier story. More damning evidence around